Hi there. Today I will be talking about the opioid crisis, but more specifically, needle exchange centers. This presentation is by Elise Winter, Avalon Bentz, and Britta Stramberg. First, I will be starting with an overview. The opioid crisis is a public health emergency in many parts of the world, but especially the United States. This has led to a surge in overdose deaths, the spread of infectious diseases, and significant social and economic costs. One of the public health interventions implemented to help minimize these effects is the establishment of needle exchange centers. Needle exchange centers are facilities where individuals who use injectable drugs to obtain sterile syringes and safely dispose of used and dirty ones. These centers may also provide other resources like HIV and hepatitis C testing, overdose prevention, education, and access to Narcan, addiction counseling, and referrals to treatment. The purpose of the center is to reduce the spread of infectious diseases, less deaths due to overdosing, and to connect people with resources on the education of these drugs. Moving on to the pros and cons. The opioid crisis has caused devastating harm, but has also led to meaningful events that have changed the overall image of public health. The opioid crisis has caused harm to many, including widespread addiction, overdose deaths, increased rates of infectious diseases from needle sharing, and a social and economic disruption across many different communities. On the other hand, the crisis has also promoted many positive developments such as the awareness of addiction, access to treatment through medication-assisted therapies, and strategies like needle exchange programs. While the overall impact has been negative, the crisis has led to meaningful policies, increased accountability for pharmaceutical companies, and a stronger focus on mental health. Needle exchange programs have also have many pros and cons. Many fear that providing clean needles may be seen as condoning or encouraging drug use, and many fear that they will attract crime, increase visible drug use, or lower property values. On the other hand, needle exchange centers reduce transmission of HIV, hepatitis B and C, and other blood-borne infections and offer access to health screenings, vaccinations, wound care, overdose prevention, and referrals to addiction treatment and social services. Next, moving on to our group stance. Ultimately, all of this information has led to our official group stance, which is, while we understand that addiction is a crippling disease, we believe that simply enabling the drug consumption will not combat the opioid crisis as a whole. We believe the best way to combat this is to treat the addict as a person entirely, focusing on mental, physical, and spiritual health. Providing better resources to combat addiction at the root will be overall much more beneficial as a society. Lastly, moving on to the rationale of our group stance. When examining our group stance, we found various factors that contribute to our final conclusion. When offering support groups and rehabilitation centers, this is going to treat the root cause of a drug addiction itself, instead of giving drug users a place where they can access needles to further harm themselves and with their selected drug. This is going to aim to change the overall trajectory of drug users' lives by giving them the resources needed to quit substance abuse. When an individual has access to support centers and is willing to change, they have achieved self-autonomy because they will be taught that their actions do not define who they are. The employed at these rehab facilities and support groups follow the American Nurses Association Code of Ethics in the sense that they are collaborating with these individuals in order to reduce health disparities and ensure that comprehensive care, which guides people struck with substance abuse on the pathway of healing. This also follows along with the Nurse Practice Act because within this act, it is imperative for nurses to approach situations like this in a therapeutic way to change behavior and aid in the path of recovery with the use of evidence-based practice. Thank you so much for listening to our presentation, and I hope you have a great rest of your day.